As concerns rise over failure to fully advise subjects of the COVID-19 vaccine risks, lawsuits claiming violations of the Nuremberg Code are also on the rise.
It's 117 employees versus the hospital that hired them, with Houston Methodist nurse Jennifer Bridges leading the charge.
People trying to force you to put something into your body that you're not comfortable with in order to keep your job is just insane.
It's a debate now up to the courts to decide. Weeks back, Houston Methodist told its employees get the COVID-19 vaccine by June 7th or lose your job.
And yes, it's being used under EAU, but at the same time, that is experimental by definition.
Attorney Jared Woodfill says first they filed a declaration action asking the court to declare that policy illegal, and then an injunction asking to keep the hospital from firing them on June 7th. 4 of the plaintiffs, all in upper level positions, have already been fired. They're also suing for damages.
Our weekly medical contributor, Dr. Akili Muhammad, is here with us once again to discuss this matter further. Greetings, sir.
Greetings, ma'am. How are you?
Great. Now, do you have any experience with Methodist Hospital in Houston?
Yes, I actually did my residency program, which is our training after medical school in the medical center in Houston. And so I spent, it wasn't the main hospital I worked in, but I spent a few months with a mentor of mine who was a gastroenterologist doing some work in Methodist Hospital, yes.
Okay. What is your view of the suit that the Methodist employees have pinned against their employer?
Well, it's interesting because I spent time there at Methodist. I noticed that there was an aura in Methodist that they considered themselves one of the best. And I would agree with that. They are probably one of the best in the medical center. There was a hospital that I worked in frequently called St. Luke's that I also thought was very good. But I'm saying that because the confidence in the aura that the employees of an institution have is a large part of the success of that institution. And I think it's very interesting that the pro-vaccine ideology calls everybody else, lead-headed. They're not open-minded. But in reality, if you have people that work in the healthcare field and have been doing so for many years, and there are a certain percentage right now, there are estimates from 50 to 60% of the healthcare workers across the country are either against or very concerned about getting the vaccine. Why would that not be taken in consideration? So to me, it's a very interesting suit because it does a number of things. Number one, it shows that the system of vaccinations has no desire to meet people where they need. It's a force vaccination. Number two, I think it's very beneficial that there were people at this Methodist hospital that were strong enough to say that they were going to stand up and sue this corporation, because there are many healthcare workers around the country that right now are concentrating on Houston to say, let me watch how this happens so we know what we're going to do. There are plenty of them like that around this country. So this could be the spark of a healthcare revolution to a degree. And then the third thing that I think this is really indicative of is that we have a system that is falling apart. We have a system that is failing, has been for a long time. But this whole pandemic has really shined the light on the inadequacies of a medical system. But yet out of this same inadequate system, there is this idea of forcing a medical idea on the entire population of this country. So it's going to be an interesting next couple of days, and of course, the next few weeks and months as these conclusions start to come out of this suit.
Right. Now, the employees who have filed the lawsuit are citing the Nuremberg Code. Can you tell us a little bit about that code, and why do you think they are citing it?
Yeah, so the Nuremberg Code is a code of ethics that the medical community is supposed to abide by when it comes to treating patients, when it comes to experimentation, when it comes to any aspect where a person that doesn't have the same knowledge as this healthcare professional needs to be educated so that the decision that they make to be a part of this medical treatment or this experiment, that they're making an educated decision and not one based on the money or whatever benefit they get from doing this experiment. Now, this Nuremberg Code came out of the concentration camps and the whole situation that happened with the Jews in Germany. And the interesting thing about this whole Nuremberg Code is that it has never been protecting Black, brown, and indigenous people, nor the poor. And so to me, the fact that Methodist Hospital, with my experience, is mostly white. It is an affluent hospital in Houston. There are a lot of presidents and other so-called big name people that were treated and taken care of in this hospital. So it's considered a prestigious hospital. But for these people to stand up, again, as I said earlier, I think it's very interesting that they're standing against something that they fear or have a concern with. Right. And based on the Nuremberg Code, they are 100% right in standing against it. The concern that I have is that, again, the majority of the people out, those 117 people, I don't know what the demographics of them are, but I would probably lean to the fact that the majority of them are white. Right. And so the Nuremberg Code stands for them. But when it comes to the experimentation and the medical mistreatments, the practice and the deaths and the debauchery that Black people, poor people, brown people, Native people have suffered in this country, it is never applied to us. So this is going to be very interesting on how this suit protects them as employees of Methodist, but also how that is going to roll out into other segments of the society.
Now, what would you say, or what are at least one of your thoughts about how this will affect other healthcare institutions?
Well, based on what I'm hearing from colleagues of mine around the country, like I said before, there's, everybody's estimating 50 to 60% from the statistics that I'm reading. But the people that are working in some of these hospitals are saying that it's more like 70 or 80%. So for conversation's sake, let's just keep it at 60. If you have 60% of employees at facilities and institutions around this country that are saying, I'm weary, I'm afraid, I do not want to take this. And in order to keep from developing consequences, they say, we're not going to take the shot. And if you decide to fire us or decide to demote us, whatever, we're going to sue like they did in Houston. Now you have a healthcare revolution, like I mentioned before. But then the other side of that I am concerned about the general population is if Methodist does not, the employees of Methodist do not win, if this winds up being a negative for them, if a lot of them wind up losing their jobs, or all of them wind up losing their jobs, what happens if 60% of the healthcare workers in this country decide to picket, decide to go on a strike, or decide just to leave the healthcare field, period, and do something else? That's going to be a pretty significant hit on that system that is already lacking and has already proved that they can't handle this pandemic. That would be a pretty serious threat, not only to the healthcare that general people seek, but to a large degree, that's one of the most successful industries in the United States at this time, the healthcare system. And so if healthcare employees decide to walk away in the amounts of 60%, 50%, or 40%, it's going to be a serious problem in this country.
Now, with that being said, that's probably at least one of the short-term outcomes of a case like this. What would you say, or what ideas do you have about a long-term outcome of a case like this, whether they win or lose?
Yes. So I would look at that as a dichotomous reality. The beneficial side is that healthcare workers come to a conclusion that the system was broken anyway. And so we needed to produce something better and something more serving of the people. Because here it is that we have an industry that is supposed to serve the people. But the majority of people that I talk to are believing that there is no serving of them. They are being used. They are being taken advantage of. They are being kind of used as a money bag. Mm-hmm. So if that is the concern of the people that are going to get care from a healthcare system, then the system has made the healthcare professional the one that's being served and not the person who is sick. And so if this system winds up having 60%, again, 50 or 40% leave, then it's going to fail. That system will not be able to keep up with the number of people that are still seeking help. Because here's what we really have to consider. The numbers of COVID have gone down. The severity of disease in a large number of people have gone down. And so there's kind of a relaxing. But if vaccines are going to cause this number to go back up, which is a possibility, then what is this healthcare system going to do when people are pulling away and pulling out of it because they're being forced to take a vaccine that they're not willing to take? So we're looking at a pretty severe and a horrendous failure. But the good thing is that when something fails, something new is going to come up out of that.
That's right. Now, during that clip, we saw or we heard mention that 4 of the higher ranking, I guess I would say plaintiffs in this lawsuit have already been fired. What do you think that means to the group, the 117 of the lower, I guess, not so much class, but lower position healthcare workers? What do you think that means in regard to the fear that they might have about losing their job?
Yeah, so I think that speaks to 2 things. The first thing that it speaks to is that there is a very serious concern in hospitals, in urgent care centers, in medical facilities around the country, because there are a lot of healthcare practitioners that are saying, I'm seeing more people that are having vaccine problems than I'm seeing with people with the actual virus. I'm seeing people that are suffering more from vaccine adverse events than I saw some. I'm not saying all, but some people suffer with the actual infection. And so if there are 4 high position people that have already been fired, that to me sends a signal to those that are so-called lesser workers, right? That's all false anyway. But I mean, from the perspective of these people in these superior positions being fired, that is a intimidation tactic to some degree. I don't know the specifics of it, but that's what I would look at it as these nurses and MAs and the doctors and the other people, the x-ray technicians and the phlebotomists, the whole system of people who are saying, you know, I'm kind of concerned about this vaccine, but they fired a vice president, they fired the CO or whatever the name is, then that person has to feel very vulnerable at losing their job. So it's an intimidation factor. But I think the other aspect that it shows is that although this government is trying to push this vaccine as a safe reality, why are there so many healthcare practitioners that are not agreeing with that statement? If you have 40, 50, 60% of people across the country saying, look, I'm in the hospital, I'm working, I know what I'm seeing, and I don't want to go down that road, then that's a glaring disagreement with CDC and the FDA and this government in general, and how they are saying that this vaccine is safe and effective. Because people that work in the healthcare field that are giving this vaccine and then seeing the people in the hospital, they would be the first ones to see the evidence of that.
Right. Now I'm going to pause you right there, Dr. Akili. I want to bring you right back after we pause for announcements from our sponsors. When we return, we'll have more with Dr. Akili on this. We'll be right back.
Be a part of the force that powers truth in journalism. Go to nnvnews.com/donate.
Worldwide, 24 hours a day, 7 days a week. Download the Final Call Radio app and take us everywhere. On your phone, on your computer, on your tablet, on Instagram, Facebook, and Twitter. You can also log on to finalcall.com and click the Listen Live button or finalcallradio.com. Final Call Radio, the official voice of the Honorable Minister Louis Farrakhan and the Nation of Islam.
Please share your thoughts with us in the comment section below. Follow us on social media at NNV News, and please subscribe to our YouTube channel at National Network View. I am Anissa Muhammad with NNVnews.com.
Currently, we're speaking with Dr. Akili Muhammad about the Methodist Hospital in Houston and the lawsuit that 117 of its workers have filed against the hospital. Dr. Akili, what are your thoughts on the data that has been recently reported stating that 70% of Californians have had their first shot? And according to the CDC, 50% of Americans have been fully vaccinated.
Yeah, I know. Those statistics sound like they could be conflicting, but one thing about California is it is a very pro-vaccine state. There is, should I say, a group of anti-vaccination, or I should say, people that are promoting vaccine safety. But in general, California is a very pro-vaccine state. So I would expect that their statistics would be higher than the general statistics around the country, because there are states that are typically considered pro-vaccine, and then there's states that are not considered pro-vaccine. So when you take the entire American statistics and put it all together in that pot and try to come up with a general number, I don't necessarily think that it really is the picture of some states that are really not. For instance, a state like Utah, they're not necessarily a high vaccination state. Montana is not necessarily a high vaccination state. There are a lot more independent-minded people that live in those states. But when you come to some of the states that have large urban areas, typically you have people that are not as independent. They typically are inundated with information from whoever their medical practitioner or whoever the medical ideology that's being presented to them. Don't ask a lot of questions, don't do a lot of research. And so typically those areas tend to have a larger vaccination rates. And so that state would be considered more of a vaccination state. And so, these numbers that are being tabulated across the country, is very difficult to come to a conclusion how accurate they are. Because when you're talking about 50% or 70% of a country or a state, when the vaccines were first being introduced to the society and when they were supposedly being made in these companies and they were about ready to be sent out to the public, there was a huge concern on how millions of people were going to get vaccinated. The system doesn't have the capability to do that. And so when we look at the fact that we have been vaccinating people since December, 50% of America is approximately 170 million people. And we have to understand that J&J was kind of behind the Moderna and the Pfizer. And then there was a period of time where they suspended it, right? So we're talking about a lot more people that are taking the vaccine that necessitate 2 shots. So we're really talking about a lot of manpower, a lot of vaccinations that it would take to vaccinate 170 people. I don't remember exactly what off the top of my head. It was probably about a year ago I did statistics on how many people are in California. It's a large number. And so California would be just as threatened to be able to make the same reality. 70% of Californians vaccinated. That's a lot of healthcare hours. That's a lot of shots, a lot of centers, a lot of places that have to be open in order to vaccinate that many people. You know, it's kind of hard to think that we've done that many people in these 6 months, going into the 6th month of having these vaccines available.
Right. Now, with the inflation, I would assume the inflation or potential inflation of these numbers, you did mention something important, which is a lot of healthcare hours. Recently, we've spoken to you about potential profits that these vaccine companies can make. I've seen and heard of vaccine clinics being held at churches and even drive-through clinics where you don't even have to get out of your car.
Yes.
With that being said, would you say that with these numbers being reported, is it for the benefit of the vaccine company's profit, or is it for the benefit of encouraging more Americans to get the vaccination?
Yeah, you know, that's a very serious thought that I think people need to spend a little time thinking about. So let's just kind of just put a little thinking cap on for a second, right? How long would it take for 50,000 people to get vaccinated in a drive-by free vaccination clinic, right? Take quite a bit of time. Got to ride up. They got to get your information. They got to clean your arm, stick the needle in you, you know, make sure you're not bleeding. There's a 10-minute wait period that you have to watch this person after you get a shot. Where is that going to happen? You see what I'm saying? Right. So if we just consider, let's just use a city like Atlanta. And you say that there are 4 different free vaccine sites in Atlanta, 50,000 per center. That means 200,000 people per day, right? Okay. How many days would it take you to get to 1 million? That's a week. How many weeks would it take for those numbers to equate 50% of America? That's a lot of vaccines. And so, again, I don't know what the accuracy of the numbers are, but what I do know is that early on in this pandemic, I did a story, one of my programs, I talked about the CEO of Pfizer and the CEO of Moderna, both men that consider themselves Jews, white Jews, right? Mm-hmm. 2 people that consider themselves having worked hard and got to these positions. And within 6 months, these people went from rich people to billionaires. So when we talk about the numbers and are they inflated or deflated, are they real? The reality is that one day we're going to get actual facts, right? Most of the time it happens long after all of this kind of fervent reality that we're going through happens. Mm-hmm. But in 6 months, these men went from whatever status there were to billionaires. And so that to me is a large part of why we have to question what's going on, because 6 months for these people to become billionaires, and there are 7 other billionaires, and all 9 of them are with companies that are producing a vaccine. See, these are the type of facts that we have to pay attention to. Because if you and your life is going to be risked for somebody to have money or for a company to rise in its ability to keep the stakeholders or the stockholders happy, then we really are seeing the reality of how the general population, the poor white person, the black person, the brown person, the native person, some of the people that are coming from other parts of the world, you are starting to see how you really don't matter, how you are just a statistic to help make somebody rich. But at the end of all of this, you are nothing but an experimentation subject matter. And so that's a very harrowing thought. But we have to consider these ideas, because what's happening in front of us with the VAERS system and the number of vaccines that have already been put into this country, we're looking at a very horrible, probably end of this year.
Now, speaking of the VAERS system, how accurate do you think the information that is being reported online is?
I think the information in the VAERS system is very accurate. because these are the way that people report that is an individual report. So you either have a person who had these symptoms and are concerned about the symptoms, reporting them, or you have a doctor who has asked the questions and done their investigation to see if it's potential that it is the vaccine that caused this. And so when it comes to the numbers, a lot of people are reporting that only 1% to 2% of people that have a problem with a vaccine actually report it on the VAERS system. So just for easy math, let's just take it to 5%. There are, from the last I checked, 380 something thousand reports of adverse events from this vaccine. And so if we make that number easy for math and say there are 400,000 people that have had an adverse reaction, and that's only 5% of the reporting, then we really are talking about astronomical numbers of people that are having a problem.
Right.
But I think the way that VAERS was set up was a system that wasn't popular. It wasn't made very popular so that everybody would know about it. But I think those who are reporting, I have learned that it is in alignment with the statistics and the research that I've done over the years. So I do have some confidence in the information that comes from it.
Okay, let's pause for announcements. These are our final announcements from our sponsors. When we return, we will speak with Dr. Akili about the vaccine push on children. We'll be right back.
Be a part of the force that powers truth in journalism. Your support helps to combat false media. Cash App, NNV News.
Asiatic Minds, online education, helping our children to discover their God-given skills, gifts, talents, and passion that will allow them to see their greatness as well as the greatness of our people. And upon discovering that greatness, infusing them with the desire to use it for the betterment of themselves, their families, our people, and the world. Classes begin September 1st. To enroll, visit AsiaticMinds.com.
This is Sister Sajda Muhammad. We are proud to announce that the Sajda House commemorative Elijah coins are finally here. This priceless heirloom, made from recycled copper from the messenger's home, is now available at sajdahouse.com.
Greetings from National Network View. This week's Final Call cover story headline reads, "The battle in the sky is near." For 90 years, the Nation of Islam was mocked and ridiculed for its teachings on the mother plane and its aim and purpose. Now the government admits these UFOs are real, vindicating what the Most Honorable Elijah Muhammad and the Honorable Minister Louis Farrakhan has warned of and prophesied. This FCM volume number 35 edition middle page article is a message by the Honorable Minister Louis Farrakhan entitled "The Will, the Great Mother Plane, the Power of the Will to Destroy." To read more, subscribe to FinalCallDigital.com and tune in to the all-new Final Call Radio. This is the NNVNews.com Final Call Cover Report.
Please make sure you leave your comments and questions in the comment section below. Follow us on Facebook, National Network View, and make sure to check us out on Twitter as well, National Network View. This is Sergio Gutierrez with National Network View, signing off.
Children as young as 6 months are being selected for COVID vaccination trials. Dr. Akili, thanks for joining us again. Is this safe?
No, I don't think so. I don't think there has been enough time for us to truly understand and come to a conclusion on what's happening in adults. And of course, as most people have seen within this last month, it's been approved for the 12 to 15 year range. So for them to already have dropped the number to 6 months And then again, it hasn't been approved yet for approval. It's still in the emergency use phase. It just really doesn't make a lot of sense to me, because the generation that's lower than 15 didn't really have a lot of cases. It really wasn't a large population that was having a lot of struggles with the COVID infection. And so it really doesn't make a lot of sense to me why this is happening. I can only speculate why. One of the things is about money, but coming to a conclusion on why they're doing it is difficult, because I don't have any information that makes me see the insight. But I'm very concerned because, as I've said before, adults have kind of reserve because of our just larger size of our bodies, the more maturity of our bodies, the time that we've been in and around things that could threaten our system, and we overcame them, or just were strengthened to some degree. The younger generation doesn't have that, especially when you're starting to talk about 1, 2, 5, 7, 9, 10-year-olds. Mm-hmm. These young people, most of the time, don't have a very strong system. They're not large enough. Their bodies haven't matured enough to have a good reserve. And so I'm very concerned that not only are we going to see a lot of side effects, adverse events, but I'm concerned that there are going to be a lot of young deaths.
Yes.
And as we are seeing information now, and it's difficult to decipher, it's going to become that much more difficult when you include children. And the fact that children have a more difficult time explaining what is going on to them. A lot of times when children are sick, it's more difficult to figure out what's wrong with them for all the reasons I mentioned. And so I'm extremely concerned. And that's why I continue to say, I'm not trying to make myself out to be an important person, but literally what I've been watching over the last year and what I've been watching since December, as far as these vaccines are concerned, I really don't see a good outlook for the rest of this year when it comes to vaccinated people, to the healthcare system, nor those of us who have a lot of dependency on what the government says. I think this is going to be a pretty tough last portion of the year.
Right. Now, recently when we last spoke, we learned that there is no difference between the dosage that an adult receives and the vaccine dosage that the 12 to 15-year-old range children are receiving. Do you have any information on whether or not are the children who are in the trials that are 6 months to 12 years old, do you know what the dosage will be for them?
No, I actually don't. And I've actually been looking for that information, and there's speculation, but I haven't seen anything yet specifically stating what that dose is for the 6 month. I pray that we're not giving a 6-month-old the same dosage that you're giving adults. I pray that that's not happening, but as of right now, I really don't have any concrete evidence. I've only read a couple of things where people are speculating, but I don't have any information to be able to answer that knowledgeably.
Okay. The potential effects, like we were speaking about in our previous segment, the potential effects for children so young. As you mentioned, it's hard to figure out what's going on. We already see a number of adverse reactions from the vaccines that are already approved for children this young. Do you think that this vaccine would be added to the existing vaccine schedule that many follow for the vaccination of their children?
Yes, I think that's what's going to happen. They're going to try to introduce it into the schedule that's already in existence. So the great number of vaccines that a child is getting before they even enter school is about to go up, because more than likely, from the stuff that I'm reading, this vaccine is going to be suggested every year like a flu shot. And so when we discuss the rise in vaccines and the rise in neurodevelopment problems in the population of this country, especially Black boys, that is a huge concern of mine, because as I go through the VAERS report on an occasion that I do, I try to check it once or twice a week just to see what's going on. it is inundated with people who are having headaches. It's inundated with people who have had a history of migraines, and when they got the shot, all of their migraine symptoms came back. Or people just with this confusion or this feeling lazy for a few days. That really concerns me because of my research over the years of vaccines. And can I prove that these vaccines cause autism? Of course not. But there are some great associations that it could be possible. And these pro-vaccine people out here don't even want to look at the statistics. They don't want to look at the healthcare professionals that are a little leery. And they don't want to look at the reality of parents that are really trying to truly tell their story, that they know what happened to their child. This is being dismissed as just anti-vaccination rhetoric, craziness, bullheaded people. But in reality, we're looking at a large population of people that are truly concerned. And if the healthcare industry, if the healthcare system was truly what it's supposed to be, we would pause and do a little more investigation versus trying to push this on to people. But again, by the time 2021 is over and we move into 2022, it's going to be very clear whether people that are vaccinated from COVID are in large having problems. And as the time goes on into 2022, we're going to be witnessing what's happening to all these children that are getting vaccinated. Because, of course, the trials are now, but the way that everything else has been rushed through, I'm thinking that before the flu season, which is supposedly when it gets cold in this country in a lot of places, which is, November and December, October, November, December, if they try to push it and start vaccinating children before the cold season, it's not only going to be a bad 21, it's going to be a bad 22 as well, unfortunately, in my humble opinion.
Right. Now, immediately after this program, you will have, you'll be on to discuss the Ultimate Wellness Group. What is the subject matter for this evening's broadcast?
Yeah, so I'll be discussing this evening some of the same topics that we've been talking about here, but there was a town hall meeting that the Children's Defense Fund had last week. And there were a number of presenters on there that spoke on different subject matters that are probably would be considered the opposite of the mainstream ideology when it comes to vaccinations. And so we'll be talking about some of the ideas that were posed on that show. We'll be talking about what we should be doing, where our mind should be when it comes to this pandemic. We'll be discussing what we're seeing around the country where sporting events and concerts and places and things and events where people are gathering in large numbers are starting to reoccur. And so we'll just be discussing all of those things, where we should be, what we should be thinking, how we should be going about being careful in a time like this, and whether or not we should come to the conclusion that the pandemic is over. So that'll be tonight at 8 p.m. Eastern Time. The Ultimate Wellness Group on YouTube, the THEE Ultimate Wellness Group on Facebook. So please come and join us. We'd love to have you.
Thank you, Dr. Akili. This has been an insightful and very informative program tonight. I appreciate your commentary, and we look forward to speaking with you again next week.
Thank you for the wonderful question, sister. I appreciate you.
Yes, sir. Thank you for joining us today and tuning into National Network View News. Please share your thoughts with us in the comment section below. Follow us on social media at NNV News, and please subscribe to our YouTube channel, NNV News. This is Rosalind Parks with National Network View News. Good night.
Be a part of the force that powers truth in journalism. Go to nnvnews.com/donate.